Australian paramedics respond to more than 9,000 calls for help every day.
We've got at least 2 patients down.
Working around the clock.
Twist slowly, one leg at a time.
Fighting to save lives.
Ready, set, go.
Cameras across Melbourne give unprecedented access.
Hold on, people.
You're okay.
To the daily lives of these emergency service heroes.
2 weeks, there's so many risks and complications that it's so scary.
Oh, oh, oh.
Don't worry, we've got a job. Water broken on the bus. Yes!
Mike and Eamon are also on baby watch.
First thing that goes through your head is, shoot, like a little bit of panic. Let's get you up onto our stretcher so we can have a look.
Tommy, we got a code 1. We're going to put on the light.
And big dreams for a budding little paramedic.
High five, Tommy.
Emergency services, tell me exactly what happened.
My friend, I think she's gone into labour.
How many weeks pregnant is she?
32.
At Melbourne's Emergency Communication Centre, a caller is on the line asking for help for her pregnant friend.
Can you see any part of the baby now?
No.
Is she having contractions?
Are you having contractions? Yeah, she is.
Okay, is this her first delivery?
Yes, it is, and it's twins.
Receive details. Can you please mark me en route? Thanks.
Intensive care paramedic Cam is now on his way to the young woman. Reports of an early labour have him worried.
32 weeks is still considered relatively premature. It's not ideal. So if it's just some labour pains, I'd say that we'll just pop her in the ambulance and run her down to Monash. But if she's in active labour, we might be delivering twins on scene.
Cam still has vivid memories of the last baby he brought into the world. An unexpected home birth on a bathroom floor.
Recently, I delivered a beautiful, healthy little girl.
There we go. Where's Dad? Come in, mate.
It was amazing, and it was great to be part of that. But she was full term, and the mum did all the work.
Are we going to smile? 99's arrived.
But this one scares me a little bit.
Already in the ambulance, mate.
Realistically, I don't want to deliver 32-week twins before we get to hospital.
Hello. Hello. How you going? My name's Cam. Active labour.
This is what we're trying to work out. It seems to be constant in nature. It's not like coming and going.
You all right? Yeah, nice breaths, easy breaths. That's the way.
Brittany's twins aren't due for another 8 weeks. Cam could be facing a risky delivery in the back of the ambulance.
Is this your first pregnancy?
Yeah.
At 32 weeks gestation, there's so many risks and complications associated with it that it's so scary. Babies often come out unable to warm themselves. They don't have the ability to breathe properly. And when I've got possibly 2 babies, I just don't have enough sets of hands.
Oh, ow. So breathe through it. Don't hold your breath. Breathe, breathe, breathe.
I find city very stressful.
That's because you're a farm boy.
Amanda and Taz are also on the night shift and working right in the heart of Melbourne.
If I have to change the whole English literature of the word city,
Yeah.
I will replace it by stress. So I'm going to Melbourne stress. I'm going to Delhi stress, rather than I'm going to Melbourne city.
Turns out there's a damsel in distress close by. A call's come in from a woman who's fallen over and can't get up.
A 30-year-old female, fractured, leg. She fell down 1 step. Unable to move, ankle, minus, plus, pain, minus, ? So I don't know what kind of pain she's in. It's got minus, it's got 2 plus, and then it's got another minus, and then it's got a question mark.
I hope it's a good one.
Good fracture.
Well, you know, I haven't done a broken bone yet, I don't think.
Really? You haven't seen a broken leg? But then I sometimes forget that she's very new into the job.
I know that's a really horrible thing to say, but I hope it's a good fracture.
Taz's partner is definitely still new in the ranks, but Amanda is about to achieve a major paramedic milestone.
I've done a fair few dislocations, but I haven't done any fractures, so...
After 3 years of study and 1 year of on-road training, the rookie will finally graduate in 2 days' time.
She's done from one step, so
but if
it's
she
not like
falls on
she's
the-
fallen from Mount Everest.
Yeah, but if she falls on the right angle, it'd be easy enough to do.
When I finished school, I really wasn't sure what I wanted to do. And then a friend of mine suggested that maybe I should just apply for paramedicine and see how I go. And lo and behold, I got in. And it's grabbed me from day one. Ever since I've stepped into this role, I've just wondered why I didn't do it earlier.
I have no idea where we are.
Tonight's emergency call was made from the deserted streets of an industrial estate, and Amanda and Taz are struggling to locate their patient.
We can't find this location.
We are lasted.
Stand by one. I'm just going to zoom in on the map and have a look for you.
It's not very well lit, is it?
It's saying it's the corner.
Yeah, I know.
Oh, here.
Oh.
RC701, we have located the patient.
As the team approaches, they find the woman distressed and all alone, stranded on the nature strip.
I'm Taz and I've got Amanda with
Hello.
me. What's your name?
My name is Ipsita.
Ipsita.
Yeah, so I fall down there.
Yeah? Did you hit your head or anything?
No.
All right, let's have a look.
Oh. Ow.
Nice, easy breaths, okay? Good on you.
Across town, 26-year-old Brittany thinks she's gone into early labour.
Is that pain coming back again now? Where's the pain exactly, Brittany?
Over here, but there's so much pressure.
Yeah, okay. But no show, no water's broken, nothing like that. And you've been well throughout your pregnancy, have you?
Yeah.
In 15 years as a paramedic, Cam has only helped deliver 3 babies. Premature twins will be a lot more challenging.
How bad's the pain when it comes on?
It kills.
Yeah, it kills. Have you taken anything for the pain?
No.
I can see she's distressed with it, but I'm suspicious that there's something else going on as well. The ambulance that got there before me have already checked, and she hasn't got any signs of active labour or any waters broken or the like, so it's my job to really try and hone down on what's happening.
And you're a healthy person normally? Why?
Mental health issues.
What sort of stuff?
Depression,
Yep.
anxiety, ADHD.
Okay.
She's got a lot going on. She's 26 years old, she's pregnant with twins, she's on her own, she's away from her family. You know, I feel for this girl.
Breathe, 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 breathe. When these contractions come on, this is what we're doing, like this. Breathe, 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 breathe. In through the nose, out through the mouth.
I don't actually think she's in labour, but I can't work out what's going on with this pain.
Okay.
Where's it coming from?
Now, you said that you felt...
It's got a funny shape, like in the middle.
She's obviously got pain on the right side. I'm not an obstetrician, so the best thing I can do is give her some pain relief, try and calm her down, and take her to a hospital that can deal with both.
All right, we're going to get going.
Whether it be the babies or whether it be some kind of medical emergency within her stomach.
You tell me when another one of those big pains comes on, okay?
Oh, ow.
Did you hit your head or anything?
No. Ow.
Let's have a look. Is it hurting this side?
Yeah, it's paining very badly.
In the deserted streets of an industrial estate, Taz and Amanda have come to the rescue of 30-year-old Ipsita.
The good thing is that you are moving your leg.
Yeah.
And you can feel my touch.
Yeah.
She was on her way to pick up a parcel from a freight company when she tripped and fell. Now, she's in terrible pain.
Oh, I've broken leg.
This is the side is very hard to break. This is more like a sprain.
Oh.
Well, I'm not sure if this is actually broken, but the way Ipsita is moaning and screaming for pain...
Is this the more here?
Yeah.
She needs to get into the ambulance. We need to take her to hospital to get this investigated and x-ray to rule out any possible fracture.
That's it.
Oh my God. Oh.
My heart goes out for Ipsita.
Would it be easier if you were to pull on that, darling?
Her husband is interstate. She's got no immediate family members there, no friends there.
That's it.
We'll get out of this cold and we'll do a few things in the truck.
So for us, it's time to step up, become her family, and I need to give Ipsita reassurance just to calm her down, make her feel better.
Yes.
These ones? Good. And you can feel my touch?
Yes.
Good. How's your pain out of 10?
I can give 5.
Okay.
Yeah.
We might just put a little splint Epsita, okay? And then we'll give you something for pain.
Okay.
Okay?
Yeah.
I'm looking at Ipsida's ankle and it's definitely swollen. It's definitely deformed. But hey, Dr. Taz's gut's feeling, I think it's not broken.
Sorry.
Going to be a little bit painful, unfortunately.
But the way Ipsita is moaning and screaming for pain, I could be wrong. It may be broken.
Oh.
I'm so sore from Pilates. I worked so hard. Oh, I can't lift my arm above there.
Nat and Leonard are starting their night shift and waiting for their first job.
I need some goggles. I brought them today.
So unprepared.
Leonard has a systematic approach to everything in life.
Before I go to work, I run through I'm like wallet, phone, keys, spare pad, pen, spare pen torch, spare pen torch.
How often does Nat go, wait, I don't have a pen to write anything down? Well, here you go, Nat. I came prepared for you as well.
Oh, hello. Found a pair.
Emergency services, tell me exactly what's happened.
There's a gentleman here that's feeling lightheaded and swelling over. Yeah, we need an ambulance.
Is he awake?
Yes, he is.
And is he breathing?
Yes, he is.
Okay, we have been called to a 70-year-old collapsing. A bowling club. Patient's now nauseated, sweaty, clammy.
This could be a number of things. It could be a heart attack. It could be a stroke.
Here we go. Enter via the gaming area.
Someone's got their hands up.
We've got a waiver?
Yeah, we've got a waiver.
Okay, brilliant.
As Nat and Leonard arrive at the bowling club, their patient is just inside the entrance.
Hi, I'm Natalie. Who have we got here? Hello, sir. Jimmy. Hi, Jimmy. What's going on with you tonight, Jimmy?
I'm trying to be sick, but I can't.
Jimmy's wife, Linda, watched horrified as her husband of nearly 50 years suddenly collapsed.
He says, I'm not feeling 100%. And he got up and he went to the toilet and he didn't get very far before he fell over. He'd gone from being normal to being grey in colour and freezing.
Any pain anywhere, Jimmy?
I've got to be honest with you.
Please.
I've had a few.
How many drinks do you think you've had tonight, Jimmy?
Probably.
More than 5?
Oh, yeah.
Oh, yeah.
Jimmy tells me he's been drinking for the past few hours, which changes everything. I need to find out, are these symptoms of alcohol intoxication, or is this some sort of medical emergency complicated by the fact that he's been drinking?
We might pop you out onto the stretcher where I can check you out properly. We'll need to look at your heart, your lungs, temperature, sugar, all those sorts of things.
It'd be easy for me to say this is to do with alcohol intoxication, but it's dangerous to do that because if we do, this could be the difference between life and death.
I've never been this way before.
Wow, first time for everything, isn't there?
Let's get you out to the ambulance.
Oh, ow, ow. There's sore there.
Is it?
Yeah.
What from?
I don't know. That's what I was a bit worried about today too.
Okay.
Intensive care paramedic Cam is trying to work out if Brittany has gone into early labour.
You can breathe on this, okay, and that'll help with the pain. No, not at all. Not at all.
Pregnant with twins, the 26-year-old believes she's having contractions. Cam is not so sure.
Hey, but you need to calm down a little bit as well. Okay, Brittany, hey, look at me for a minute. Your health and baby's health is paramount, and when you're stressed, babies will get stressed. So you need to find your happy place, okay, so they can be happy.
This is Brittany's first pregnancy, so she's unaware of what's happening to her body. For all she knows, she thinks, is this labour? Is this normal? She's got no idea. She's scared and she's vulnerable.
As far as the babies are concerned, right, the hospital's saying that the babies are really healthy. Is that correct?
Yeah, they're pretty good.
Do you know what they are? Boy, girl?
Girl.
One of each.
Yeah.
Names?
After one, Evie Patricia and Ryder Shannon.
Beautiful. Beautiful.
As an AMBO, you get little snapshots of people's lives. You come in and you're there for such a brief time. More often than not, it's during a crisis.
Nice, easy breaths, okay? And these were about 20 minutes before we got there, is that right?
Yeah, all my legs went numb.
Yeah.
I just blacked out for a second, and then I woke back up and had the phone, so I just rang Nan.
When we get to the hospital, we can get them to get in touch with Nan straight away, if that's all right. okay?
I will.
Yeah.
Talk to my dad. I miss her so much.
I'm happy Brittany's got someone in her life. Her nan sounds like someone that will look after her. The way she talks about her, she must be a lovely lady. But at the moment, she's not there. All she's got is me in the back of an ambulance. She's scared, she's in pain, and she's got no idea what's going on either.
We'll go inside and we'll just let the guys assess you and work out what the best action is, okay? Good on you. You can keep breathing on that if you want, Brittany.
In hospital, Brittany will be tested to check that her twins are still healthy and make sure they're not coming early. As for Nan, she's on the way.
Brittany's still got a long road ahead of her. She's trying. She's got some demons that she's still battling, but she's doing her best to try and stay healthy for the sake of her babies.
How much have you had to drink?
Not enough.
Not enough.
Leonard and Nat are about to start treating 76-year-old Jimmy. He suddenly collapsed at a bowls club, complaining of dizziness, sweating and nausea.
I've got no balance.
All you need to do now is swing the legs up, and then we're on. Good man.
They urgently need to find out if he's had too many drinks or if he's suffering from a serious neurological issue, like a stroke.
Thanks, Linda. I'll check him out a bit more, though.
Just don't know what happened to him. I'd be devastated if anything had happened to him. He means the world to me.
Lift up both hands, grab hold of my fingers. No, hold on to my fingers. Squeeze.
One of the ways that we can test for stroke is to form a grip strength where we see if one hand is weaker than the other. We get them to smile. We need to see if they've got any facial droop and to get them to talk, to see if they've got slurred speech or an inability to talk.
So what's bothering you the most?
Very dizzy.
So you're dizzy?
As soon as I stood up and I said to Linda, have we got to go? And I stood up and I fell over. I couldn't even walk.
This is a really difficult case because alcohol intoxication can present with identical symptoms to a stroke, but we need to make the right decision because it can have massive implications on his health.
There's no chest pain, is there, Jimmy?
Jimmy?
Yeah.
Hello, where did you go? What happened there?
I was just thinking.
You were thinking?
I'm asking Jimmy all these questions, but he's just not answering me. He's vague in his responses. It's really hard to work out what the problem is when the patient's not giving me much to work with.
I feel as if I can't even think. You understand what I'm saying?
I do.
Outside, Jimmy's wife is anxiously waiting for news. The couple are regulars at the club. Linda runs the raffle every Friday, while her hubby has a few beers.
I was a nervous wreck. I was just shaking. I didn't know what to think because I didn't know what was going on in the ambulance.
I'm going to ask the wife.
I was definitely frightened that there was something dreadfully wrong and that I could have lost him.
Do you think he was drunk or
No.
he drinks more than that normally?
When he was talking to me, he wasn't slurring his words. He could speak normal. He was speaking to me normal.
He just couldn't get up without falling over or...
All of a sudden, it seemed to get him like that.
It was really helpful to talk to Linda. She was able to tell us that what was happening to Jimmy was not normal and that he was not just drunk. So I knew that something serious was happening tonight.
Neurological symptoms can also present with dizziness, vomiting, unsteady walking pattern, all of which you're complaining of.
Yes.
But all of which present with alcohol intoxication as well. I can't differentiate between the two, and that's why I will take you for a checkup.
If Jimmy is having a stroke, then we need to get to the bottom of it straight away, start moving to hospital as soon as possible.
Now I'm getting a bit of a headache.
Okay.
Sorry.
It's going to be a little bit painful, unfortunately.
30-year-old Absida is having a bad night. She took a tumble in the street and may have broken her ankle.
We might just put a little needle in your arm and give you something for pain.
Taz and Amanda are doing their best to keep her calm.
You don't have very good veins, Ipsita. You're tiny.
Because I'm fat.
No, you're not.
Really?
Who says that?
Who says that? My husband says.
Tell him that Taz and Amanda says to go and get his eyes checked.
Ash, where are you from?
Have a guess.
India.
Oh, I'm from a place called Banaras.
Where are you from?
I'm from Odisha.
Oh, yeah. How long have you been living in Australia for?
3 years.
3 years.
Yeah, finally I got my PR today.
Time to celebrate?
PR today.
Celebrating here in ambulance.
Turns out today should have been wonderful for Ipsita. She had finally received her long-awaited permanent residency.
I think someone who's born here probably doesn't realize that feeling when actually get a letter from the government saying that you are a permanent resident of Australia from today. That just gives you such a great joy. It is a big day for Ipsita. It is like probably one of the biggest day in her life. And here she is celebrating an ambulance on day one.
Right to go?
Yep, let's rock and roll.
With pain relief on board and her ankle splintered, the celebration party can now move to the nearby St Vincent's Hospital.
What number would you give the pain? Before it was 5. What number would you give now?
A little bit like 4.9. Like.
4.9?
I think.
So in 17 years, you're the first one who has scored the pain rating 4.9. That's wonderful. In my whole career, no one has ever told me that we have helped them in their pain by 0.1. That's gonna go into the history books of Ambulance Victoria.
Ipsita's ankle will now be x-rayed to find out just how much damage has been done to Australia's brand new permanent resident.
How's your pain now? 4.7, 4.8.
Pop them on and tell me if you can see me clearly.
Yes,
Okay. Do you feel dizzy at the moment?
slightly.
Nat and Leonard are worried 76-year-old Jimmy may have had a stroke when he suddenly collapsed during a night out with his wife.
You feel dizzy or is the room spinning around you?
No, there's no spinning. this
Not
time.
spinning, but you feel a bit dizzy in your head.
Jimmy's becoming increasingly vague. His speech is slurred and he's struggling to answer questions.
At the moment, what's bothering you the most?
One is thinking.
So a bit foggy. Yeah?
As they arrive at the hospital, Jimmy's responses are becoming even more erratic.
Do you feel better now than you did half an hour ago, do you think? Because you fell over, didn't you?
No.
You didn't? You told me you fell over twice.
Yeah, well, I did fall over because the...
Did you hurt yourself when you fell over?
Yeah.
You did?
What?
Jimmy will have immediate tests to find out if he's had a stroke.
I think I'm a bit confused.
Yeah, me
Are
too.
you? Okay.
I'm glad we got Jimmy to hospital safely.
Let's take you inside.
If Jimmy is having a stroke, this could have a major impact on his life.
Oh. What's wrong? You gonna vomit?
We've got a job.
Water broken on the bus.
Yes!
It's the start of a new day for Mike and Eamon, and it's going to be interesting.
You're the expert at catching babies, mate. So, what have you called 4 now?
If so far,
The first thing that goes through your head on your way to an imminent delivery is shoot, like a little bit of panic.
Patient is on a bus and her waters have broken. The length of her pregnancy is unknown at this stage.
If it's a boy, you've got to get her to name it after you.
oh, I'll be pushing very hard.
Yeah.
But even if it's a girl, Eamon is a wonderful name for a girl.
Oh.
I think every ambo makes the joke when they go to a woman in labour that they want that baby named after them. I don't think we ever actually expect it'll happen, though.
Oh, we've got an update.
All right. So she's at a bus stop. She's 32 years old.
Yeah.
She's in her first trimester. I suppose that adds a level of complexity to the job.
Early pregnancy bleed can be normal, but yeah, water's broken
Water's
definitely
broken,
sounds
yeah.
unusual.
It can mean any number of things. Perhaps it could be misinterpreted as something.
Is that someone waving? Just got to prop in here. Arriving at this scene, this woman is on a bus in a very public place, so we need to make a pretty snap decision on what the game plan is going to be.
Hello, guys. Okay, thank you. Everyone has cleared out except our patient. She could be in a lot of trouble. My name's Eamon. I've got Mike with me.
Hello.
What was your name?
Sharnali.
Sharnali. Your waters have broken, I understand?
Yeah.
Okay. I can see how nervous she's looking. She's obviously really worried, and that's starting to get me pretty concerned as well.
What I want to do is I want to get you off the bus and into our ambulance, just so I can give you a bit more privacy and I can assess you a bit better through there. Do you think you'll be able to take a few steps for us so I can check her out?
It's legit.
So we'll come this way.
Emergency services. Tell me exactly what's happened.
My husband just can't breathe.
Short of breath, is he?
Yes.
Is he changing colour?
He's very, very pale.
99 received, thank you.
Micah paramedic Cam is on his way to the man in trouble.
So I've just been requested code 1, so lights and sirens, by an ambulance that's on scene with a 76-year-old male who is extremely short of breath, so that's all I've got to go on at the moment. There's so many things that it could be that leads to shortness of breath. Hopefully we get a little bit more information just before we arrive, so at least I'm prepared as to what I'm going to walk into before I do walk in the door.
This patient's going to be unwell. I know that already because I've got a crew on scene requesting an intensive care paramedic quickly. Hello. G'day. Hello. What's your name?
Mrs. Yenna.
Mrs. Yenna. Hello.
We've got fluid here. Unknown issue. Quiet blue, non-responsive.
By the sounds of it, Philip was critical when they walked in the door. They said he was blue, unconscious, barely breathing.
Did he complain of a headache or any problems today? Has he been well today?
No, he is never well.
Oh, yeah.
He always goes, always complains. I can't breathe.
Yeah.
I've been here, I've
Yeah.
been in the back.
Okay, Philip. Philip.
Your body relies on oxygen. If you're not getting enough oxygen, the cells can't work properly and your body starts to fail.
Hey, Philip. Philip.
All right, we're going to head over this way to the ambulance, OK? How's your English?
I understand some English.
OK, a little bit, OK.
Mike and Eamon are dealing with a very different emergency.
I'm going to follow her up. You wait there just for a tick for me, sir.
32-year-old Shanali is pregnant. She was on the bus with her husband when she feared her waters had broken.
Now, how many weeks pregnant are you?
6 weeks.
6 weeks pregnant, so it's very new.
Today morning, 9:30,
Mhm.
we have an appointment,
Mm-hmm.
Royal Women's Royal.
OK, you went there this morning. Is that where you were coming back from?
English is her second language, so we've got to ask her some reasonably complex medical questions in really simple English. It's quite challenging for both Mike and I.
So you had an appointment today at the hospital. Was everything normal?
Yeah, they said that everything is normal.
Good.
But,
Can I please borrow that folder? Reading the discharge summary, there are concerns for her baby, so much so they're going to follow up again in another week. And that was even before this quite dramatic changes happened. So she needs to come to the hospital with us today. We will take her to the women's hospital. All right, so just take a seat there for me, sir.
OK.
Doctor check everything, baby okay or miscarriage.
OK, so that's what they're querying. They're not sure yet if you've had a miscarriage?
Doctor, no, not sure.
And then today on the bus, you were coming home from this appointment, I assume, and your waters have broken?
My pant is
Yep.
some water.
Water.
It could be something as simple as a bit of incontinence, or it could even be, sadly, that she's losing her baby.
I'll get this shut so we can get some cool air in here.
That's good. All right, and swing your legs up here for me. I'm going to give you some seatbelts, and we're going to take you up to the hospital.
I cannot imagine how anxious and afraid Shanali and her husband are for what's going on with their baby. Just give us a word when you're ready, mate.
No worries.
Philip. I just don't understand why he hasn't woken up a little bit.
Intensive care paramedic Cam is trying to get a response from 76-year-old Philip, who's just collapsed in front of his wife, Yana.
It looked as though he did open his eyes a little bit there. He's a little bit sweaty.
The guys are doing a great job at getting his oxygen levels up. They've given him a couple of injections of adrenaline to open up his airways. They're assisting his breathing, but he's still got a lot of gas trapped in his lungs. And the fact that Philip hasn't woken up, he's in a lot of trouble.
Just see if you can elicit a response from him again, even just verbal initially.
With the help of medical records, Cam discovers Philip has a history of asthma and chronic emphysema.
What was diagnosed first, asthma or emphysema?
That's what I don't know.
Okay, did he have asthma when he was a child or not? Okay.
When I look at Jana, I think she must be very stressed at the moment. I'm sure she's never seen him collapse like this and remain unconscious, so it must be frightening for her.
What we might have to do is put a breathing tube down his throat and take him off to hospital with that.
Cam now needs to put Philip into a medically induced coma. Intubation is a risky, invasive procedure.
99, can you just tell me who my backup is, please?
To perform it safely, a second intensive care paramedic is needed.
Philip's body's working so hard just to try and breathe, but it can only do that for so long before it tires, and I'll have to take over his breathing totally.
I'm going to prepare to intubate this patient, and then on arrival of 27, he can give me a hand, thanks.
By intubating Philip, we'd insert a breathing tube. I've requested another Mike paramedic to come and give me a hand with the procedure, so I'm going to get all of the equipment ready so when he walks in, we can just do it.
Hey, Philip! Philip!
Did they mention anything like diabetes, gestational diabetes? No? Okay.
Mike and Eamon are on their way to hospital with Shanali. The 32-year-old is in the early stages of pregnancy and is worried her waters have broken.
We know that we're not going to be delivering any babies today, but we've still got a couple that are really concerned about their unborn child.
It sounds like it potentially could have even been a syncope episode.
Oh, yeah.
Says she felt sort of quite lightheaded, had the nausea as well.
We start to float the idea this could be a syncopal episode or a collapse or faint. And that sort of fits, you know, it's a warm day. She states she hasn't been drinking very much water. She has a bit of a low blood pressure normally. So this may actually not be related to pregnancy at all.
How long have you and your husband been married for?
4 years.
4 years. Is he a good husband? She has to say that, doesn't she?
There's not too much that I can do for Shanali.
Have you thought about how many children you want to have?
2.
2. That's a good number.
Except try and make this experience a little bit less traumatic for her and try and make her laugh.
You know, a very good name, the best name for a child, Eamon. Yeah. Eamon. Yeah. So it's a good name for a child. Boy or girl, doesn't matter. The best name.
Look, I think Mike is a very popular name. It's a very reasonable name, easy to pronounce. I think Mike is in with a much greater chance than Eamon.
What made you come to Australia?
So I am doing PhD.
I see. You'll be a doctor one day. A doctor of sorts.
Doctor of philosophy.
I think my hope for them is that they do have this family that they so obviously want. Whatever the outcome is today, it's obvious that they love each other and that this won't stop them.
We'll bring you on our bed. I'll have a chat to the nurses and we'll go from there.
Hi, how you going? That was all right? Good.
Eamon and Mike have Shanali smiling again, but they know there may be bad news when doctors at the Royal Women's Hospital assess her for the second time today.
Eamon, tell them what's happened, show them your paperwork, sort you out.
Hey, Phil! Phil! How are you, buddy?
Cam is still trying to wake emphysema patient Philip after he collapsed at home, struggling to breathe.
So as I'm preparing equipment to intubate Philip, I start to hear him groan and his respiratory pattern change a little bit. He's showing signs of waking up.
I'm going to leave him how he is, get him onto a vac mat. We're going to slide him out into the back of the truck and reassess. It'd be horrible to wake up to this sort of thing.
As his brain starts to come to a little bit, he would have heard all these strange voices in his house and feeling something in his mouth and all this equipment. It must be very scary not knowing what's happening.
Okay, pull that out. Suction, suction, suction. Thanks.
As Philip starts to regain consciousness, a second intensive care paramedic arrives. Cam will now have backup in case he needs to insert a breathing tube.
When my other Micah paramedic arrives, it is relief. It means that we can share the decision-making and manage him together.
So what we're going to do, Jana, is we're going to slide him out and onto our ambulance stretcher and put him in the back of the ambulance, okay? And then off to Dandenong Hospital, but I'll have a little bit of a chat to you before we go.
I'm sure she's seen him sick before, but not this unwell. It must be terrifying.
With Philip's condition improving slightly, the team is using an evacuation mat to move him to the ambulance.
Hey, Phil, it's okay. It's the ambulance.
We reevaluate and decide that we're not going to intubate Philip now. We've got a relatively quick trip to the hospital. He's responded to our treatment, but there's always a chance that he's going to deteriorate and we might have to flick back to plan B.
Philip, do you have any pain? You don't have any? I just can't breathe yet. Okay, we're going to get going. This medicine is trying to help you breathe, do you understand?
So did you hear we have a surprise today?
Surprise?
A surprise visitor. Yeah.
Who is he or she?
I don't know, it's like a real surprise. It's not even like an Amanda surprise where I actually know what's going on.
Taz and Amanda are back on duty, but before heading out, they have a visitor.
I don't know, maybe someone wants to meet the Bollywood version of Denzel Washington.
Oh, who's this little guy?
Ah, what we got here?
Tommy.
Hey, brother, I'm Taz.
Tommy.
Hey, Tommy, nice to meet you.
9-year-old Tommy's called in with Mum Justine to deliver a very important letter to his paramedic heroes.
I wanted to give it in person.
Look at this, what a little legend. How cute is that? I have a question I would like to ask. Is it hard to be a paramedic if you have mild autism and dyslexia? Love from Tommy.
Tommy?
Yes.
You can do whatever you want in your life.
Definitely.
Yeah, let's go.
Some people want to be footy players, soccer players, but I've just always wanted to be a paramedic.
Oh, Tommy, we got a code 1. We got to put on the lights. Beautiful. Off we go, nice
time
and
to
safe.
save someone's life. I had that dream of becoming a paramedic, and looking at Tommy, I could see a little Taz in him. So this is our medication bag. You know, sometimes we need to put a needle in.
Am I getting one now?
Nah.
It just reminded me of my struggling days and my challenges coming from a different country, hardly knowing any English, but I had that dream. The only thing I can tell Tommy is that just don't give up and you'll get there. All in your hands, do it.
I have never seen a child so excited to see just something that we take for granted every day. And it's such a special thing for him. And he's so determined. There's no doubt in my mind that he's going to make this dream come true.
All right. Tommy?
To keep the dream alive, Taz and Amanda have a gift for Tommy.
You are graduating as a student paramedic.
Yes! How cool is that?
And I will do the honor from one side. Do you know, Tommy, this is one of the proudest moments you'll ever have because this is what I felt 11 years ago.
Oh, was it?
Yeah, when someone gave me my epaulets. So well done.
And now you've got proper ones.
High five, Tommy.
It's a very special moment for me, but especially for Amanda because she's congratulating Thomas for starting a paramedic journey. But on top of that, she's just a few hours away from graduating to become a qualified ambulance paramedic.
See you later. He's loving it.
It's good. I like surprises.
Yeah, it was great. Yeah.
Okay. Hey, Phil, so we're off to hospital. Does your breathing feel a little bit better now? Yeah. Poke your tongue out for me. Yeah, good. Okay.
Micah paramedics Brenton and Cam are taking 76-year-old Philip to hospital after he collapsed at home.
Do you know where you are? Do you know what day it is today?
Philip's wife Yana found him on the floor unconscious and struggling to breathe.
Are you okay, hon? Yeah, so Yana, he's responding to me now. When I talk to him, he's trying to talk to me, okay? So he's a lot better than before.
Philip's shown a lot of signs of improvement, but he's still not conscious and alert.
So Yana, you've never seen him like this before?
Not that bad.
Not that bad. How long you been married?
48 years.
48? Wow. You must be a very patient woman, hey?
And he must be very patient.
Oh, see, I was giving you the get out of jail. Yeah, he's very patient too. Okay. Phil, we're at the hospital. Can you wake up a bit for me?
Philip has stabilised, but Cam is extremely concerned that he's still barely conscious.
From here, I'm sure that they'll do further tests. They'll be able to x-ray his lungs and see exactly what was going on with him. I suspect he'll be in the hospital for a little while.
Open your eyes for me. We're at the Dandenong Hospital, okay?
Do you need a bit of help?
6 letters. Could be a temple.
It's been 4 weeks since Jimmy suddenly collapsed at a bowling club in front of his wife, Linda.
How are you doing?
Getting there?
I feel as if I can't even think. You understand what I'm saying?
I do.
Jimmy was taken to hospital suffering what Nat and Leonard suspected might be a mini stroke.
I've never been this way before.
I was definitely frightened that there was something dreadfully wrong and that I could have lost him.
Jimmy was in hospital overnight for tests, but doctors found no evidence of a stroke.
Here's your sandwich, Jimmy.
Thank you. My doctor, she said to me that maybe it was because of drinking. Beautiful. Lovely. Sometimes I thought that people might have been right. I was drunk. I believe I wasn't, but I'm slowing down a bit, even on the drink.
Hey, Phil. Phil, how are you, buddy?
Cam's patient, Philip, was closely monitored for 4 days and was sent home with oxygen to help with his chronic emphysema. Mike and Eamon were called to help Shanali when she feared her waters had broken on a bus. Sadly, Shanali lost her baby, but she and her husband are still hopeful they'll be starting their new family in Australia very soon.
Oh. That's so bad.
Is it?
As for Brittany, turns out Cam was right. Her abdominal pains were not an early labour. But 17 days later, Brittany did deliver beautiful, healthy twins. A girl, Evie, and a boy, Ryder.
So I fall down there?
Yeah?
Yeah.
Did you hit your head or anything?
No.
All right, let's have a look.
When Taz and Amanda's patient, Ipsita, fell off a curb, she was in a lot of pain.
It's broken, right?
But Taz was pretty sure the ankle wasn't broken. And the results are in.
When I heard Ipsita only sprained ankle, and I was thinking, Dr. Taz, right again. I'm just happy for her, and she'll be able to celebrate permanent residency of Australia.
And finally, it's Amanda's very special day. After 3 years of study and another year on the road as a rookie, she's graduating.
I'm feeling so anxious. I've got butterflies in my stomach and the anticipation has been incredible.
You look a little nervous.
I am super nervous. I don't know why.
Congratulations. Well done.
Thank you, honey.
Veteran paramedic Taz has been Amanda's partner and mentor. Today, he's like a proud dad.
Well done.
Thanks, Taz.
I think you deserve it.
Thank you.
To see Amanda from student life to finally graduating is beautiful. It's really a happy moment.
It's a milestone day too, for a very important 4-legged member of Ambulance Victoria.
This day was special enough, but I get to share it with Bruce the Labrador, the peer dog who's also graduating today. Bruce was implemented as a peer dog approximately 12 months ago just as a trial to see whether or not he would break down barriers for the peer support crew when they go and see a paramedic after a tough job or going through a tough time. And Bruce has been popular from day one.
Please welcome and congratulate Amanda.
I can't believe, looking back, that I've finally done it and I've jumped all of the hurdles required and I'm here and it's happened and I'm qualified. And, you know, there are rare moments in life where you get to look back and go, I did it. This is definitely one of them.
If there's survivors, they've probably only got minutes to live.
All in the water, through with vests.
It was going to be the most dangerous thing I'd have to do.
Without a doubt, this is the biggest paramedics of the year.
One of the most heroic rescues ever seen.
The extraordinary rescue.
The paramedics on the way down.
That will have Australia on a knife's edge.
1 minute I can see him, the next minute I can't.
Aussie bravery.
The story actually gets quite heartbreaking.
Like you've never seen. The biggest paramedics of the year. Next Tuesday, 7:30 on 9.